Well, welcome back to Daybreak Extra on Trust TV. Now we're on to the discussion segment. I will be talking about the topic beyond the scrubs, the hidden toll of long call hours on Nigerian doctors. The medical profession is one of the most demanding and high-stakes careers, requiring precision, compassion, and dedication. However, behind the scenes, Nigerian doctors are facing an alarming crisis. The strain of long call hours is taking a toll on their physical and mental well-being. So today, we're discussing this issue, the alarming cost of long call hours and lack of equipment to work as medical doctors. So joining us today this morning is Dr. Amin Usman, a medical doctor and an advocate for doctors, who will share their insights on the impact of prolonged working hours on doctors' health, patient care, and the overall healthcare system. Dr. Amin is joining via Zoom. Hello, Dr. Amin. Good morning. Thank you for joining us.
Thank you, Maryam. Good morning. Thank you for having me.
Thank you very much. So what is really happening in the Nigerian healthcare system? What is happening? We just, according to the topic, the hidden toll of long call hours on Nigerian doctors. Please, let's hear your take on this.
So once again, thank you for having me. It's as you rightfully described it, Nigeria healthcare system, as we all know by now, is in a state of, crisis. And we say it's in a state of crisis because it's a healthcare system that is not able to, provide the adequate care to, the citizens, and also look out for the well-being of its healthcare providers. So it's in a state of serious turmoil. You have healthcare providers leaving the country in large numbers because there is no, protection to their health per se. And the main reasons why they're leaving the country is because there are serious issues with their well-being. One of which is, if we take, for instance, the doctors, the working hours of doctors, which we are here to talk about today. The working hours of doctors in Nigeria is very excessive. And looking at the nature of our job, caring for patients and patients' lives, you would think that we would have, a system that looks out for these healthcare providers to ensure that they are in the right state of mind to give adequate care to patients. But it is, the opposite. Doctors in Nigeria work excessively long hours. We're talking about 106 hours a week. This is just an average number. The Constitution of Nigeria, gives a cap on the work hours for civil servants not to exceed 40 hours a week. However, you find doctors in Nigeria working more than 106 hours a week. This is just an average. And they take what we call the call. And because of our nature of work, you wouldn't say patients won't get sick in the night or during the day. There is no specific time you would say that patient will come to the hospital. So we have to be in the hospital. Doctors have to be in the hospital all the time. So we take what we call the call, and the call basically means a doctor will be in the hospital 24 hours. So he starts his work by 8 a.m. and ends the shift 8 a.m. the next day. So if a doctor would go a stretch of these hours, you would think that doctor should have at least some breaks, in between those hours, or have a break after those hours. Go home and recuperate, have recovery of yourself as well before you continue the work. But doctors go on a 24 hours work in Nigeria. After doing that 24 hours work without breaks, you can be on your toes all through 24 hours. And then the next day, you are still expected to continue that work till the closing hours of that day. So you're doing another 8 hours shift. So in the long run, you'll be going through 36 hours on a stretch. And then in extreme situations, you have doctors who are doing this every single day of the, every single day, the whole month. So this thing has gone on for a very long time now, and it has gone unchecked. There is no regulation whatsoever anywhere that says this is exactly what doctors should do and all of that. So it seems like no one even really gives a damn what is actually happening. We hold meetings and conferences and looking at, the quality of care that patients receive, but on the background, no one actually checks what truly is the problem with the outcome of the care that patients receive. And this happens that patients come to the hospital and patients come and receive the care that is not really optimal. They meet doctors or nurses that are frustrated. They come and meet long queues. They come and they say there's no bed space. They will come to the hospital and some equipment are not even there, you understand, for the doctors to work with, to take care of them and all of that. So patients receive suboptimal care. And the reason for that is because those on the background doing the job are facing all these difficulties and they are not able to give their best, you understand, to patients' care. And this has been the case with, the healthcare provision in Nigeria for a very long time, and it's really a sad one.
Now, you mentioned about the medical doctors leaving Nigeria for searching for greener pastures, finding a very suitable working environment. Can this be the reason of the lack of doctors here? And can it be the reason why doctors have to deal with long hours of working?
Oh, yes. So doctors have left. The Honorable Minister of Health himself has stated, early this year that there are about 16,000 doctors who have left the country, searching for greener pastures in other countries over the last 5 to 7 years. Now, this is just an arbitrary number, to be honest, because if Nigeria, as I said, we don't really have, if you go to Medical and Dental Council of Nigeria now, they can't tell you exactly the number of doctors that have left the country or those that are not practicing yet. That is why we don't really have the actual numbers. But take it as 15,000 doctors have left the country. That is a huge number. We are a country of 220 million Nigerians. 220 million Nigerians, if you have 16,000 doctors leave, it's a big number for them. We don't really have enough. He said we are left with only 50,000 doctors. That leaves the country to 10,000 population to, two doctors taking care of about 10,000 population. So the reason why they're leaving, of course, it has to do with these issues that we're talking about. The issue of remuneration. There are what we describe as the pull factors that those countries offer to these doctors that we don't offer in Nigeria, the incentives. We have been dealing with poor remuneration, poor salary structure for doctors in Nigeria for a very long time now. And every time you find doctors go on strike, it's always about this poor remuneration. They will always just sign memorandum of understanding with the government, giving promises, and at the end, the promises will fail and another strike will go on. The toll is always on the patients losing their lives and all of that. The second thing is also about the poor structure of the healthcare system or the infrastructure and the lack of basic equipment. You go to hospitals in Nigeria, a doctor, you have the knowledge to take care of patients, but without the right equipment for you to do what you are trained to do, you're not able to do that. In front of you, you will have patients losing their lives. That takes a toll on your mental health every single time because of consumables. We're talking about cannulas here, not even CT scan or X-rays or those sophisticated machineries. We're talking about basic equipments like cannulas. A cannula will not be available in the hospital. A parent brings his child to the hospital. who needs an oxygen. A doctor cannot immediately administer oxygen to the child. The parent has to pay for it. It's either the hospital doesn't have that facility, or if they have, the parent cannot afford it because of, the economic hardship that is going on in the country, and the hospital or the state government does not subsidize that. Cannula, IV fluid and all of that, we have to write for patients to go and buy, either in the hospital pharmacy or outside the hospital, to go and buy and then come back. There is no adequate medical record keeping as well, or there is no good referral system, digitalized referral system. Let me take you back. Just recently, we had a story of a woman in Abuja who lost her twins. And thank God for a woman who captured it, who would not have seen it. Now, this is one woman. This is just one woman out of many others who have gone through this bad system. She lost her twins just because there is no bridge in referral between where she is coming to where she was going in Abuja. Now tell me, if a woman like that cannot access help in the state capital, I mean in the nation's capital, Abuja, where else would she get help from? She lost her babies, and that has gone normal. Everything has gone normal now. Now, the other thing is also about the working condition itself. Doctors in Nigeria face, as we've been talking about, excessively long working hours. So those countries outside of Nigeria provide all of this. You find countries like the UK or the USA having guidelines regarding the working hours. So that would sound very good for a person that is working in Nigeria, and he would definitely want to work in somewhere that takes care of his well-being and also provides good remuneration and all of that. A doctor in the UK would earn 10 times what a doctor in Nigeria would earn in a month. He would earn it in a month. What a doctor in Nigeria would earn in a year, he would earn 10 times of that in a month. So tell me, how would they not leave and go to the United Kingdom? So these are the issues.
Okay, you mentioned a little bit of the mental pressure, the long working hours affect doctors. So can you share, or do you have some personal experience or stories of doctors who have been affected by long call hours in most Nigerian medical centers?
I am one.
Oh.
I am a living witness of the long working hours in Nigeria. I have left. I'm no more in Nigeria now, but I have been there. And that was the reason that sparked this conversation for me. I was in a state where I started my residency back in Nigeria, in pediatrics, with a very big passion for taking care of, our children and all of that back in Nigeria. And I have been on call. I've done this 72 hours call that we're talking about, a doctor being on 24 hours call 3 times. You be on call from Friday, Saturday, Sunday, and you continue the work of that Monday till the closing hours. So it puts you on a very long 72 hours work stretch. I was on that, and most of the times when I am on that, it takes a great toll on me mentally, affecting the way I care for patients and all of that. But I still try to give my best. Now, a day came when, after that long hours, I was going back home, driving back home, and I zoned out, and me and my car, we fell into a gutter. And I was rushed back to the accident and emergency. And at that moment, what came to me was that would have been it. That would have just been it for me. I would have just lost my life, and the work will continue like nothing ever happened. And this has been the case for many doctors. Now, just last month, we have lost a colleague. In fact, early this month, we lost a colleague, Dr. Femi Rotifa, after being on call for 72 hours.
What? 72 hours?
Yes, he was on call for 72 hours. And after that,
2 days, actually.
in fact, not after, he is still on duty, in the morning of his last day, in the call room, in the hospital, he was found dead. Now, this is a doctor that spoke initially that he was not feeling fine, he was sick, but he was still meant to do he was still made to do the work of that day. He was still in the hospital. He's not the first one. We have lost so many in the past as well. We have lost Dr. Michael Umo in the past to this 72 hours work. We have lost another doctor in Nasarawa a long time ago, Dr. Ahmad Isaiah. He died after doing surgery in the theater as well. There are so many of them. These incidences have gone on for a very long time, and I've said it has gone on unchecked, and it's really taking a toll on the doctors, mentally. I'm currently doing a risk assessment survey of the whole Nigerian doctors to see what this long working hours has cost them over the years. And the responses I've been having, now we are at 469 responses. I will tell you, 333 of those responses, they all agreed that their mental health has been affected. They have had episodes of anxiety and depression over their practices. 49 of them have had miscarriages, among other, like fainting at work and all of that. So until we continue to do all of this risk assessment, we would not have data to show that these things actually happen and they actually need to be looked after. And that just needs to be, looked after, to be honest.
Okay, now let me take you to government support and policy. What policies or initiatives will you advocate for to support doctors and improve the overall healthcare system in Nigeria?
So
what
this is
okay.
Yeah, so as I've said earlier, there is no regulation whatsoever in Nigeria that takes care of doctors' working hours or that looks after the doctors' working hours, not in the training, not in the code of conduct by the Medical and Dental Council of Nigeria. And it is the sole responsibility of the Medical and Dental Council of Nigeria to look into these issues and make that policy regarding their working hours and say, look, we are putting a cap on the number of hours that doctors need to work. Recently, we have to acknowledge that there is the health workforce migration policy that was, released by the presidency under the Minister of Health, to curb this migration of doctors to other countries. However, in the whole document, there is no explicitly where it's looked at the working hours and, how to maintain or how to put a cap on the number of working hours or to put breaks and all of that. And I say we need to look at that. We need to give that a page on its own in that policy document so that these things, be given the what do you call it? The attention that it rightfully deserves. So first, I've been advocating, as we have all been advocating in Nigeria, for a regulation of, doctors' working hours, and also in that policy document that we have by the federal government to curb the migration of doctors to other countries, we should also have a page where it explicitly explains how doctors would work, their working hours, and how they would earn when it comes to remuneration and all of that incentives and all of that. That would go a long way in giving the doctors back home in Nigeria peace, knowing that they are being looked after by the people that runs their affairs.
Okay, you mentioned that there are no policies or initiatives drafted by the government to bring, solve issues regarding the overall healthcare system, the problems in the overall healthcare system in Nigeria. So now, how you've been advocating for quite a long time, and there are other doctors, advocates that have been advocating for a long time. So are there any specific changes to existing policies or laws that you think will benefit doctors and the healthcare system since you started advocating for doctors?
Yeah, so as I said, when we're talking about the specifics, it has to be, the regulation of these doctors' working hours. That needs to be looked into specifically. Also, when we talk about remuneration, let me give you an instance. For doctors or for workers in the United Kingdom here, there's what we call they're being paid for, they're being incentivized for unsociable hours. Unsociable hours mean if you work anytime between 8 p.m. to 6 a.m., that means you're basically doing a night shift. And and if you work on a Sunday or on a Saturday, that's basically the weekend, you get an additional pay on your basic pay. So that gives you that, because you're being taken away. We know weekends you're supposed to be resting, but then you're being taken away from your, from that period. So you're going to be incentivized for that. So that gives you that assurance that you're actually being paid for something, so that goes a long way. And we also need to look exactly at the call hours that we're talking about. These call hours, it will shock you to know that doctors would do this call every day of the month, and they're not even paid enough for it. They just term this as call duty allowance. And what that call duty allowance is, by the economy structure, that is the salary structure for doctors in Nigeria, is just 1,575 naira per unit of call. So you do a 24 hours call and you're being paid 1,575 naira on top of your basic pay for that. It actually accumulates to form your basic pay for that month. So you could do that. So a person that will be doing 2 of those call in a month, and you that will be doing 30 days call in a month, will be paid the same thing. So there is no justice in that system, and we need to scrap the call duty allowance and actually look exactly what a doctor will be paid for that call that he's doing.
Okay, that's right. Why do you think many Nigerian doctors, you mentioned that a lot of Nigerian doctors have left the country in search of a suitable working environment. So do you think many Nigerian doctors are leaving the country or consider leaving, and what are the main factors, like aside the long hours, are there any other factors that made them leave, or is just like the long working hours? Or is it that the salary do not really equate to the long working hours?
Yes, as you rightfully said, we'll have to speak the truth when it comes. The main reason why doctors leave the country to practice in other countries is because of the working conditions in general back home in Nigeria. You see, doctors were actually built different. Every doctor starts out with the passion to take care of his people back home in Nigeria. That has been the passion for every single doctor. So leaving the country is not really an easy decision to make. We don't just leave the country to practice in another man's country, where we know that even our parents are back home facing the same healthcare system that we have left. So these working conditions that we're talking about, looking at the remuneration, there's poor remuneration, the basic medical equipment that are supposed to be in the hospital and are not there, lack of career development when it comes to training. You find doctors being stagnant. If not for resident doctors that progress, if you look at medical officers or other, cadre of doctors in the healthcare system, there is really no progression career-wise. You just be a medical officer, in one general hospital for 13 years, 14 years, and you're still just a medical officer. Nobody checks your knowledge. Nobody checks nobody trains you or retrains you again. And this is, you would agree with me that something like medicine is it's a subject that needs, adequate training and retraining, because you're actually dealing with patients' lives. So that career development is not there, and that really needs to be looked at, because it's one of the things that draws people away, from the country to other countries as well.
Okay, now, are there any potential collaborations or partnerships between the government, the healthcare system, and private sector that could benefit doctors in the healthcare system in this country? Are they?
Oh, yes. Very recently, there have been a lot of talks about the public-private partnerships by the government, and I think is the right way to go because you find many doctors who have left the country now coming back to the country to, initiate some projects and build some hospitals and all of that that would, that goes a long way in solving most of our problems that we're having in Nigeria. But the problem is that to set up an organization now in Nigeria, it has the youth. Most of these people face a long political barrier, you understand, for them to get it set up. So when governments come together, public and private organizations come together and form, maybe a hospital or a cancer system and all of that, it goes a long way. Most of our patients or citizens back home in Nigeria leave the country to go to India for medical care or, China or Dubai or Egypt for medical care. And they spend a lot of money. We're talking about billions, even in dollars. So if we could save that back home, then we could actually boost the revenue that health would generate back home. And why I say that is because I think the federal government of Nigeria doesn't really the health expenditure, in the health budget is still less than 5%, by the federal government. And I think why it is still less than 5% is because the government doesn't really see anything coming back from health. Like it's like the oil and gas sector brings back to the country. So, but the other way to look at it is if we stop this medical tourism, this going out of the country for medical care and start building it back home in Nigeria, which a lot of doctors are now doing. Those abroad are now coming back to build institutions in Nigeria. So if we have these public-private partnerships, then I think it will go a long way in solving most of the issues that we're facing in Nigeria.
Okay, as a medical doctor and a doctor's advocate, what is the way forward? What do you think the government have to do to better the living conditions and the overall the welfare of doctors in Nigeria?
The way forward is to ensure that your healthcare providers are enjoying adequate and decent work, and they're not exploited when it comes to their remuneration and salaries. And you also look at their well-being when it comes to their working conditions and provide the basic necessary medical equipment that they need to work with. And that way, you are sure to have healthcare providers who would give their best to ensure that the right outcome healthcare-wise to the citizens is achieved. So regulating the doctors' working hours, I think the nation has to look at it. It's one of the things that is really, really, really draining our healthcare system right now in Nigeria. Also the remuneration and also other issues that we've mentioned, like the infrastructure and what have you.
Okay, what else do you have to add? Do you have anything to add to this topic before we go?
So this is just a direct call to one of our mother institutions, the Medical and Dental Council of Nigeria. I've said this for a long time that we cannot continue having an institution that's, per se doesn't really, show that they don't really care about the healthcare providers in the nation. They need to come out and have all of these surveys to look at, even if they don't have data to show of it, they need to do all of this survey and look at the working conditions in Nigeria, and they must regulate the working hours of doctors in Nigeria. They must regulate the working hours of doctors in Nigeria. There is no two ways about it.
Well, thank you very much, Dr. Amin Usman, for joining us today. Thank you for sharing your insight on this particular topic. Thank you.
Thank you so much for having me, madam.
Well, that is it for the discussion segment. We had the medical doctor and an advocate for doctors, and we talked about the long, working hours that Nigerian doctors has to deal with. And in the conversation, something took my attention when he mentioned that a doctor worked for 72 hours. Well, 72 hours is more than 2 days. You're working back to back with little breaks, and at the end of the day, he slumped and died. And there are lots of doctors that are going through same issues. Well, that is the much we can take for the discussion segment. Let's go on a quick break, and when we come back, we're going to dive right into the viral entertainment stories, especially from the social media.